Hello, and welcome to the Health Me Asia podcast. I'm John Linebaugh, and I'm your host. As the name of the podcast implies, we'll be looking at some unique and interesting healthcare services available in Asia and showcase their quality and their value. This interesting episode will be about Bangkok Hospital Chiang Mai in Thailand and a unique program and services aimed specifically at U.S. military beneficiaries and their eligible family members. This program is commonly referred to as TRICARE within the U.S. military community. TRICARE is essentially a health insurance program that provides coverage for eligible beneficiaries who are unable to get health care from an actual U.S. military healthcare facility. A second program, called FMP, offers additional coverage for U.S. military veterans with disabilities. In Thailand, there are only a few hospitals that accept TRICARE and FMP as a valid means of payment guarantee for hospital expenses. Bangkok Hospital Chiang Mai is one of those hospitals that accepts TRICARE and FMP here in Thailand. Here on the show as our guest today is the International Patient Consultant at Bangkok Hospital Chiang Mai, Mr. Chairat Nopavot. Welcome to the show today, Chairat. How are you doing?
I'm doing wonderful. Thank you, John, for having me on your show.
Good, it's great. So please tell us a little bit about yourself and your background.
My name is Sharat. I was born in Thailand, and I went to America when I was 20. A couple years later, I joined the U.S. Army, and after 22 years, I retired. I served at the hospital administrators at the American Army Medical Center for 6 years before I decided to move back to Thailand. And then I moved to Chiang Mai. I've been living here for 10 years now. And I've been working at this Bangkok hospital for 10 years. And my job is the international patient liaison. I've been taking care of the U.S. veterans who come here for their medical need, including the U.S. Military veterans that I've been caring for the past 10 years.
Great. So you're well positioned and well qualified to talk about what we're going to talk about, TRICARE and FMP today.
Yes.
Good. So I want to share a little bit about how you and I met. I was a patient here.
Oh, that's
right.
Yeah,
yes. I had surgery, and on the last day before discharge, you came walking in my room. I had no idea who you were, and you introduced yourself as the patient liaison. I think you saw my Texas state tattoo or something maybe, and you said, "Are you from Texas?" And we started talking about Texas. And then I thought, how would you know about Texas? And then you said, well, I was in San Antonio.
Right.
And then from there, like, why were you in San Antonio?
Yeah, that's why we were there for the U.S. military medical training.
That's right.
Yeah.
So after a little bit more conversation, we realized that we had both been in the U.S. military, U.S. Army,
Right.
both in the medical field, both in San Antonio.
Correct.
But maybe not in San Antonio at the same time, but we served together
Right.
at the same number of years in the same time frame, and we have mutual friends in the military.
Correct. Yes. And we still remember his name.
Yes.
Eli Claypool.
Eli Claypool.
That's
There's
correct.
one of them.
Yes.
And so we had some famous people that we used to talk about. You remember the MedCom Command Sergeant Major Clayton?
Yes.
Yeah.
That name is still stuck in my head.
Yeah.
Yes.
So we had a lot of mutual connections without ever having met over 22
Plus
years.
year, right.
22 years of service.
Can you imagine that we never ran into each other while we were serving in the U.S. Army, but we met each other here in Bangkok Hospital,
Chiang Mai. That's
Wow,
right. It could have been that we were both in the same auditorium.
Could be, yes.
At AMED Center and School.
Right.
At Fort Sam.
Yeah, but we don't know each other.
And didn't know each other,
right.
or passed somewhere. So
Right.
So it's a great story that you ended up helping me understand the work you're doing to get TRICARE on board here with this hospital, because this is one of the few hospitals in Thailand that accepts TRICARE and FMP.
That is correct. Only one of the 4 hospitals in Thailand that accept TRICARE and FMP.
Right.
Yes.
So that's a significant quality of life issue or concern, because I have a lot of friends in the military that ask me sometimes about, hey, John, I was thinking about coming to Thailand to retire like you are.
Right.
And then, healthcare is one of the biggest things.
That is correct. Especially the elders or older people. It's very difficult to find health insurance in Thailand. Above 70, forget about it. You cannot get one.
So health insurance here for a foreigner is kind of
Challenge.
expensive. Yeah.
It is.
Right.
It's challenge.
So, here's a scenario that could be interesting for people listening. A 21-year-old daughter of a U.S. military retiree or active duty on her second or third year of university comes over to Thailand for a summer break tour with her friends.
Okay.
She's out in the mountains visiting an elephant camp, and she falls off and gets injured. And so she comes here, and she can use TRICARE.
That's correct. As long as she's still eligible for TRICARE. And then she or he can be using the medical service here at Bangkok Hospital, Chiang Mai.
Right. So she would have access to essentially world-class healthcare here at Bangkok Hospital, Chiang Mai. And they would accept TRICARE as guarantee of payment or insurance
That is correct.
to cover her medical expenses.
That's right. Yep.
What are some other scenarios that you have seen, or people coming from abroad to use?
Yeah,
Bangkok
I
Hospital, Chiang
have.
Mai?
That's correct. Thank you for mentioning that, John. I have a few American or veterans that flying from Indonesia or Philippines to use their TRICARE at these hospitals because we're accepting that. So we have that occasionally. But mainly we have people who live here in Thailand that come up here to use TRICARE or FMP.
Right. So there's retirees that are here. There could be people on holiday. Somebody calls you from abroad and says, hey, what can I do if I'm in Thailand on holiday?
That's correct. Yeah, I have received the email or phone call from people from America or other part of the world that want to spend vacation in Thailand, and they're asking about if TRICARE can be used or covered if they're here. So I say yes, of course they can use TRICARE or FMP if they come to Thailand and they suffering or got injured for something, they can come here.
Right. So somebody who doesn't live here could actually just come here simply, from Indonesia, as you said, I think, to use Bangkok Hospital Chiang Mai,
That is
world-class service, and TRICARE would cover that.
That's correct. Yes.
So it's like medical tourism.
That is exactly what you're saying. Is medical tourism. Yes.
Good. I know that travel magazines like Condé Nast and some others, they typically rank Chiang Mai as one of the usually top 5, destinations in the world of a good place to retire. So TRICARE being available here, it just adds to that, quality of life issue.
That is correct. That's why many of the U.S. veterans living in Chiang Mai, like you and me. Yeah.
Correct. So let's talk a little bit about how the program works when somebody comes here and they want to find out, hey, I used TRICARE before. How do I get it here? Do I need to sign up? Is it a hassle?
Oh, that's very simple, easy. All you have to do is just walk in and then enroll it to hospital's system, register with us, and then we will go online to TRICARE website to verify your eligibility. And your name popped up. They say you enrolled to TRICARE overseas program. Then you can start using it.
What are some advantages to you guys handling the TRICARE process for them?
Oh, okay. The advantage that you will have is it's easy access to get into the systems, and we can get you to see the doctors that you need to be seen, or the specialists, and we have the expert to help you, assist you with the claim process, or give you an advice what can be used or what services they allow or not allow. So that's the advantage for you to use TRICARE at Bangkok Hospital, Chiang Mai.
So it can be used for inpatient and outpatient.
That is correct. Inpatient, outpatient, emergency treatments, all the above.
So for somebody using it here, they would pay for TRICARE. They would pay a 25%
That's correct. Well,
down payment.
first of all, they need to cover or pay for deductible. $150 for deductibles per individuals. For the whole family, no more than $300. After that, the TRICARE will be do copay. So copays, TRICARE pays 75%. You're responsible for 25%. Uh, After you have spent out of pocket up to $3,000 per that year, within that year, TRICARE will cover 100% from that point on.
Good point. So then help us understand about FMP.
Okay, the FMP, or we call Foreign Medical Program. This program is the VA program, medical benefit for retiree or someone who have served in the U.S. military and suffering some kind of injury or medical problems. So they have been awarded by the VA for certain issues we call service-connected disability. As long as they have the letters, FMP letters from the VA, and present it to us here, and then they can start seeing the specialist or doctor that related to those injury or service-connected disability. And the wonderful thing about FMP here, we will do direct billing for you, so you don't have to pay anything.
Because there is a significant time lag
That's correct.
from if they do it from payment to when they get reimbursement.
Right. It takes longer. Normally, the reimbursement process for the FMP can be up to 3 to 6 months to get your money back. So if you have to be treated for major surgery or emergency stuff, you may not have enough money to pay up front and then wait for 3 to 6 months to get your reimbursement. But if you come here, we file the whole thing direct billing to VA for you, so you don't have to cough up your money up front. So that helps a lot to
That's it.
individuals. Yeah.
Yeah, that is a significant quality of life thing for retirees living on a retiree budgeted income, and they're most likely as you age you'll have a surgery and that cost. And
Right.
essentially what you're saying is Bangkok Hospital Chiang Mai will accept the risk of waiting to be reimbursed from the FMP program directly.
That is correct. Where we will take that risk for you. And we have been doing it for 10 years now.
That's great.
Yep,
Yeah,
10
yeah.
years. For FMP, for TRICARE, we've been doing for past 4 years. So,
I remember, I think when I first came to Bangkok Hospital Chiang Mai, 5-6 years ago probably, for something that, I had to pay out of pocket and collect all the forms, scan them all in, submit all that myself to the VA in the U.S., or to TRICARE rather, and then wait on reimbursement in that way. So this is certainly much more convenient and appreciated by vets, that's for sure.
right.
So with TRICARE, then what are some things that it doesn't cover, in Bangkok Hospital Chiang Mai?
Okay. For the VA medical program, you have to keep in mind that the medication that the provider gonna dispense it to you, you have to make sure that the U.S. FDA approved drugs, okay? Because if not, you'll be responsible to pay for that. And also, they will not cover any cosmetics, anything that unnecessary procedure or treatments. So
Yeah, so if it's deemed not medically necessary
that is correct. It's not
by
necessary.
TRICARE, they're not going to pay for that.
That is correct. Yeah.
Aesthetics,
Oh, that definitely no. No pay for
aesthetics,
that.
liposuction,
Nope. No.
some and actually certain laser treatments for skin conditions
Right.
that can be traditionally used with maybe a scalpel or a liquid nitrogen treatment, cryotherapy.
That's-
They won't
yeah.
cover that.
That
as
kind
well.
of gray area,
Yeah.
this have to be more specific.
Yeah. So then, what is the best source for somebody who's not sure of, hey, is TRICARE going to cover this,
Or FMP, right?
or
So-
or
right,
TRICARE,
right.
even
Or
TRICARE.
right? So what you have to do, you need to call or contact them directly to the TRICARE online, ask them about this question, or you can contact the VA FMP program Ask them, can they be approved or can they be covered for this procedure or whatever. So they can give you the answer.
There's also the International SOS. For this region, it's based out of Singapore.
Right,
Correct?
that's the TRICARE office that based it on in Singapore. They working 7 days a week, and the people available to provide the answer or help you, assist you with your question.
That's great.
Yeah.
So let's talk a little bit about Bangkok Hospital Chiang Mai and the depth of services and specialties you have here.
All right. So the Bangkok Hospital Chiang Mai, we have just about every specialist that working here, including orthopedics, cardiology, neurology, surgeries, hemodialysis, dental, rehabilitation, uh, just about all the services that you are looking for, we have that to provide to you. And we have the specialists on duty 7 days a week. So you don't have to wait. If you want to see cardiologists or urologists or nephrologists, you can do it on a demand. And another wonderful part about this hospital is this. If you need to have MRI, CT scan, mammogram, or whatever, they can do it the same day without waiting to be
That's great.
seen.
Yes.
So this is wonderful.
What about a sleep study?
Oh, wow. That's another service that we have. We have the specialist that taking care of sleep study, and she's here every week to see the patient and do a sleep test for you.
Yes, you guys have
We have that.
you have a very plush hotel-like, five-star hotel-like
Yeah.
sleep study, a couple of rooms upstairs. I
That is
think.
correct. It's this wonderful room that we set it up for you to help you sleep. Every inpatient room is a private room. So you have your own bed, you have your own couch, bathroom. You don't share with anybody. Your family can spend the night or stay with you in your room.
So a full line of specialties, services, no wait, essentially no wait list to see those specialists, to get seen, to get access to care, to get diagnostics done. Tell us a little bit about the hospital in general, its credentials or accreditation, and a lot of the doctors. Can you tell us a little
Yeah,
bit about
sure.
that?
Bangkok Hospital have earned it that they call JCI, Joint Commission International Accreditation. Or if you in America, you probably know it, the JCAHO,
Yes.
Joint Commission Accreditation Hospital Organization.
We call
It's
JCAHO.
similar. Yeah, JCAHO,
Yeah,
that's correct.
yeah.
JCAHO, so here we call JCI. We do get that every 3 years. So we have done 3 already, and we have one coming up this month. That's going to be the fourth one within 10 years. Can you imagine that?
Yeah,
No
that's-
other hospital can do that. 10 year with 4 JCI accreditation.
That's commendable.
So that speak loudly about this quality of these hospitals and the thing that we have done in the past.
Great. How about a lot of the actual doctors themselves?
Oh, yes. Many of the doctors or specialists have been trained in America or abroad. So, for example, we have a cardiothoracic surgeons who have been working in St. Louis in a heart hospital for 5 years, at least 5 years. So he's very, very expertise or have the knowledge, and they all speak English very well. So easy to communicate with.
And what about some of the ancillary services and support staff? Not just liaison staff and customer service, but billing, nursing, the ancillary, pharmacy, lab, X-ray.
Yeah, we are self-sufficient. Everything that we do here, we can do it in-house. X-ray, laboratories, in-house laboratory. Our staff very sufficient in providing care for our patient, and they all speaking English here. And also we have another one I want to mention about is the rehabilitation center, that the state of the art that we have. We have the hydrotherapy and others method to help, and also the robotics device that we just had approved by our director. So it's going to be on hand available to assist people who have disability or very have difficult time to
move.
mobiles.
So is it like a exoskeleton type device
It's
that
similar,
they put in?
yes, similar to that, like the movie thing.
So they can stand up?
It
Is
helps you stand up, walk using your or upper extremity, lower extremities. And also, I checked with TRICARE and FMP officials on these products. They cover them. They say yes.
That's
So
great.
another opportunity for our veteran who in need of a robotics assistant or machine, we can do that.
To learn how to
Yeah.
move further and better
That's
to
correct. Yeah,
retrain their
yeah.
muscles and their proprioception. And
Yes.
tell us a little bit about the plans that are going on here now. There's a lot of renovation. What's coming down the road with the improvements at Bangkok Hospital Chiang
Okay.
Mai?
After 10 years, we have grown so much and we run out of space. So we are on process of building another second buildings, expanding our inpatient and outpatient and also the plaza to provide more recreation thing for our patient and their family. So we try to improve our services and expand all the specialty that we need more. For example, oncology services, that kind of thing.
What is the projected date that a lot of it will be finished?
We are shooting for summer next year at the earliest. That can
Summer
be operational.
2025.
That's correct. Next year we can be
Okay.
opening it up these additional services. Yeah.
Yeah, so it will genuinely be a world-class near medical center.
That is correct. Going to be the biggest one in Chiang Mai and top of the line for healthcare organization in Thailand.
Northern Thailand for sure.
That's correct for northern in Thailand. Yes, and I want to add on to that. From feedback by the foreign patients, they saying the Bangkok hospital is much better than their own countries, America, Europeans, wherever they came from, Australia, Canada. They say Bangkok hospital service and technology and professionalisms, they are better than their own countries. So
I have seen it firsthand. I've used this hospital many times and feel the same way. And I sort of liken it to just the Asian style of service. It's very professional, a very genuine type of service delivery that they provide, and I think it's fantastic. And again, I have been a patient here, and all of my what do you call that? The surveys at the end. I actually add comments and people's names, and because it was such a great experience to use this hospital.
thank you, John. Yes, we are trying to improve everything we're doing every single day.
Good. So again, it goes back to the quality of what you're paying for. And as you said, some people come from abroad and they go, the standard of care, the quality of care, the professionalism, and then the price that I'm end up paying here is such a great deal.
It is, yeah. It is much cheaper for sure in America. Yeah, we can do things. I would say, since I live in America for 30 years, is the price is much better
Yes.
and cheaper. Oh, another thing I forgot to mention: dental clinic. We have dental
yes.
clinic open 7 days a week, and I want to share a quick experience I have. When I was living in America, I came here to Thailand on vacation, and I have my root canal and then a crowning done by the dentist, Thai dentist. When I went back to America and I saw my American dentist, and he said, "Where did you get this done?" I say, "In Thailand." He say, "Yeah, they do a great job. Yeah, that's correct. They do a great job, but much cheaper than you. Yeah, 10
Well,
times cheaper."
And that's kind of the one of the narratives of my podcast in general is to showcase the quality of the healthcare in Asia and to help people understand the value proposition of getting your healthcare here.
Well, thank you so much, John, for this opportunity to present Bangkok Hospital and also to present the TRICARE and FMT programs for our U.S. veterans who have yet to learn about this hospital or this availability of this program in Thailand, in Chiang Mai.
Right. There's some retirees and vets out there that live further afield in Thailand, if you will. out on a farm or something like that, and they may be going into a smaller facility, or I don't want to drive that far, but once they know that you guys handle all the billing and get this level of care, they may actually make the trip.
That is correct. I have the guy flying in or driving in from other provinces in Thailand, hundreds of kilometers, some of them 1,000 kilometers, to just come here to use this FMP and TRICARE programs.
That's great.
Yeah.
So what we're going to do next is we're going to have two guests join us here on the podcast. Michael Peck, retired U.S. Air Force.
Right.
James Brogan, retired United States Marine Corps. And they're going to tell us a little bit about their experience using Bangkok Hospital Chiang Mai and how they ended up here in Chiang Mai.
Okay, roger that. Sounds
right.
good. Let's bring him on.
So joining us on the podcast today, we have two guests for this episode of TRICARE at Bangkok Hospital Chiang Mai. We have Mr. Mike Peck, who is retired U.S. Air Force veteran, and we have Mr. James Brogan, who is a U.S. Marine Corps veteran. So welcome to the show, guys.
Thank you.
Thank you,
You guys doing okay?
Yes.
Yeah.
Yeah,
Good.
absolutely.
So we're going to start with you, Mike. Please tell us a little bit about yourself and how you ended up here in Thailand.
My name's Michael Peck, and I retired in the Air Force after 30 years. I was a loadmaster on C-130s. And what brought me here to Thailand was my wife. I had met her the year before I had retired through mutual friends, and moved here in 2013, and I've been here ever since.
Yeah. So what brought you to Bangkok Hospital Chiang Mai in the first place?
Cancer.
Wow.
Yeah, it was pretty serious, and I was very fortunate at the time that Bangkok Hospital had just started accepting TRICARE, and there was Mr. Chirat was here. He's a retired Army vet, and once I was enrolled here, he said, "We'll take care of it," and everything was great,
So, can you tell a little bit about the care and the services and all the specialties? Did you have to do CT scans, MRIs, and what other diagnostics, and how'd that go?
Very well, very well. From the moment I was admitted to the hospital, they had a clear plan of action of what they were going to do. Diagnostics. The doctors were, I call it Johnny on the spot. They said, "Hey, you have an obstructive. We're going to send you to a ultrasound," and found out what was helped me for my symptoms, and decided I had a blockage in my intestine, which was causing me to vomit, and there was a tumor there. So they said we need to biopsy it, and within 24 hours, I knew I had cancer. And the doctors came up and basically said, "You let us worry about the treatments, and you just remain positive and worry about being healthy." And every day, I met with doctors. I met with the TRICARE rep that's here at Bangkok Hospital, let me know what was going on. As I said, I can't speak highly enough about the services here.
So, how much time was lapsing between when you first came in and then did you have to wait to see specialists and to get some of these diagnostic results done? And
No, as I said, I came in, I believe it was around noon, and I was admitted by 2, and I was in surgery that night for the rerouting the tumor around my intestine, around the tumor that was blocking whatever. And I think within 24 hours, maybe less, the diagnosis had come back that I'd had non-Hodgkin's lymphoma. I was getting chemo within 48 hours. And they had a plan of action, as I said, laid out. Dr. Bansum at the time was my primary doctor, and had assembled a team. They had all come in, mental health, dietitian, hematologist, everybody. And if I didn't understand something, they had someone there to translate. My wife is Thai, so she also was involved in it, which I found really useful because it took a lot of worry off of her knowing what was going on. They allowed her to stay in the room. I spent 6 weeks here, and as I said, the quality of care was unlike anything I've ever received. I had a brother who had passed away from cancer, and watching his care, back in the States compared to what I received here, it was like, I couldn't believe it. I thought I was in like a 5-star hotel. Appointments were, when they said there was an appointment, there was an appointment. If they once you got out of that appointment, if you had another appointment, they would take you right to your next appointment. So no waiting, very, very little waiting. But,
How long ago was that?
2020, I believe,
Okay.
I was diagnosed. And as I said, I'm still here.
I was going to ask you how the follow-up care is
Yes.
going.
I-
Almost 5 years on.
Yes, and I'm still receiving periodic PET scans. They schedule them here, so I show up at Bangkok Hospital, Chiang Mai, and the appointments that I go to are across town over by the teaching college. So I come here, I go there, they take care of the billing. All I do is I pay my 25%, and everything's taken care of. So it's really awesome, one-stop shopping.
So I was going to ask you to describe that second piece, which is the TRICARE FMP. You qualify for FMP?
Yes.
Yeah.
Yep.
So can you, elaborate on some of your experience with using TRICARE and FMP at Bangkok Hospital, Chiang Mai?
The FMP will cover any service-connected disability, 100%. So you'll have no out-of-pocket expenses covered. If you're married, it won't cover your wife, it won't cover your spouses, so it's just for the service member himself. And they bill that directly to the foreign medical program, so all I do is sign some paperwork. And it's pretty much the same with TRICARE. You come in, they hand you a form, basic information. You put your name, your address, social security number, date of birth, sign it, and then they take care of everything else. So the difference being is the 25% that you pay out of pocket. But on the upside of that is it's kind of like money in the bank without interest, because once you hit that $3,000 family
Catastrophic cap.
Bangkok Hospital keeps a running total, and at some point in time they say, we owe them such and such money, and they'll call you up and say, hey, where do you want this money deposited?
I've actually been reimbursed by Bangkok Hospital,
Yes.
Chiang Mai,
So
on one of my stays here.
Yeah.
And it was kind of, it's like getting that tax refund check at the end of the year.
yeah, it's
Give
kind
me
of
my
like
money back.
it's like
So,
kind
yeah.
of a Christmas bonus, huh?
Yeah. It was
It's a
nice.
Christmas bonus. What are we going to do with this?
It was just
so-
sweet talk.
Yeah, it's a nice surprise. As I said, I can't speak highly enough of the nurses and doctors and staff here, from personal experience.
English proficiency and
Yes, if for some reason you don't understand something they're saying, they will get somebody there for you to explain to you, so you can understand. So what can you say? You're in their country, and you're a guest, and they bend over backwards to accommodate you.
And that's one of the
and
things.
give you the best care.
Yeah, that's one of the things we keep talking about is that service quality element of the care here.
Yes.
And it's not just good medical care, but it's good customer service care and patient care.
Yes, absolutely. If you have more than one appointment a day here, say, you get done with one appointment, they walk you to your next appointment. There's no excuse not
wheelchair
to
you
show
there,
up,
or
or
yeah,
wheelchair
yeah.
you there. There's no excuse not to show up.
Yeah.
Everybody that I've known that has used Bangkok Hospital as a veteran has had nothing but positive things to say about Bangkok Hospital and the staff and the quality of care. That's my experience.
Good, great. Thank you for telling us about that and sharing all the details, and we appreciate it. So
you.
I'm going to talk with James Brogan. Thanks again for being here. Can you tell us a little bit about yourself?
Yeah, my name is Jim Brogan. I was in the Marine Corps during the Vietnam War, and I ended up coming to Thailand because I was bored with my other job, and I just wanted to do some traveling around. And I went all over Southeast Asia, and this was my last stop. And I just said, the people are so kind here, and that thing about the land of smiles is so true, because it's just a comfortable place to live and a safe place to live. I can't think of another country that's even safer.
Yeah.
You know,
How long has it been?
I've been here 16 years. I still Putai Dai Nit Noi.
Yeah,
speak a little-
A lot of us older
I
guys are like
speak
that.
a little Thai, but I have a vocabulary of a lot of words. But when I put them together, they don't know. They don't have any idea what I'm talking about.
Yeah, that's common. So then what led you to Bangkok Hospital, Chiang Mai?
The great Bangkok Hospital of Chiang Mai, yes, there's nothing like it. Exactly what Mike was saying. There's no. The thing I really love about this hospital, there's no waiting. You can. I had a problem I used to live in Jupiter, Florida, and I had a problem. It's a very good hospital there, and I was in the emergency room for 8 hours, and I'm not making that up. It was 8 hours. I have never waited here. Once you come in, they're right there to take care of you. And my brother had called me and he said, "You better check on your diabetes because mine is really bad." And I said, "I don't have diabetes." So I said, "Well, I'll go over that new hospital that they just put up when I first came here." And I went over there and went to the front desk. They spoke perfect English, and they had me go right to a doctor who took care of diabetics. She ran some tests. She said, "You really should be on medication. Your diabetes is very severe, and your cholesterol is very high, and we'd like to see you, every 2 months." And at the time, I was paying out of pocket, and I said, "I'm not coming here every 2 months. It's just too expensive." And it wasn't even expensive. I don't remember how much it was at the time. But then my brother over there, here at I think that's how we met, and he said, "You know anything about foreign medical program?" And I said, "No, I have no idea." And he said, "Well, if you're service connected, the VA will pay." So I said, "Diabetes?" So he said, "Yeah. You had when you were in Vietnam, you had Agent Orange, and I was already connected to Agent Orange, and they connected Agent Orange to
The
diabetes.
diagnosis.
So I was flabbergasted. It was great, and it wasn't not great having diabetes, but it was great coming here, and it was a pleasure. I got to know the doctors. I had personal friends here. It's just a wonderful hospital. That you have at your disposal here, that you could come here and they just take care of you instantly. You're not. They don't tell you, "Oh, you got go home. We'll set an appointment for next month." Like in the United States, and here at Chiang Mai Bangkok Hospital, it's just been it's been a pleasure to be able to come here, and it's a pleasure to talk about the hospital here because I think it's great.
You pointed out something that I think is important, where we would call it like engagement in engaging the facility and how they are so good at what they do to take care of you that it becomes a positive experience for you to, get health care, which is typically something that people aren't really excited about.
Yeah, in fact, my brother's daughter is a medical doctor, and my brother said, you should be on this medicine. And he sent me it, and I said, I already am. They knew all about the latest medicines to care for diabetes. So, I mean, this is a great hospital. I don't know about the other Bangkok hospitals in the other areas, but here, it's first class.
We were talking about that earlier, where Chiang Mai is often ranked as one of the top 5 retirement destinations worldwide.
Yeah.
And so people that would be wondering about the healthcare here, I mean, this is the perfect opportunity for them to understand what level of care they would get and the cost associated with it.
To add to what Jim was saying, when you come here, it might sound odd, but you almost feel like you're family.
Good, I was thinking the same thing.
I can't tell you, I've been here for one appointment, and the doctor will walk by and that replaced my hip, and he'll say, how's the hip doing?
Yeah.
Do you have any problems with it? What's going on? He'll ask, how you doing? It's like, wow, I've never experienced that before.
That's fantastic.
And as I said, if a nurse recognizes you, they'll, hey, how you doing? How you doing? It's nice. And as Jim said, you also run into, being an expat, you run into other members here. So you never know. You'll see Jim, hey, Jim. And it's almost like, hey, we could sit downstairs and have coffee and catch up on what's going on. So it's a wonderful experience. And just one last thing, I hope this is part of what you want to know is that I've been treated at other Bangkok hospitals, and in Bangkok, because there was some care that I needed there that I couldn't get here, and they coordinated with the Bangkok hospital in Bangkok to bill the billing back through here. So it was seamless. So I was down in Bangkok getting care at a Bangkok hospital, and everything was billed back through here. Phenomenal experience.
That's great.
Phenomenal experience.
So it's almost small town hospitality.
Yeah. I where else would you get that? Where else would you get that?
Good point.
It's just it's a good experience. If you have to have an experience in a hospital, you want it to be a positive one. And
So you've had inpatient and outpatient care here.
Yes. Yep. And the experiences have all been positive. No matter what, I've been facing here. Bangkok Hospital has always been there. So it's, as far as I'm concerned, this is the standard to meet. So if you get care and you come here, you're going to be, I think, pleasantly surprised by the quality of care, the professionalism of the staff. You're going to be treated like a person, not a patient. They're going to get to know you. So.
All right. Well, gentlemen, thank you for being here, and thank you for your input and sharing your experiences of Bangkok Hospital Chiang Mai and of the TRICARE and FMP programs. So thanks again.
Thank you.
Thank you.
All right, Chawa, let's go ahead and recap all the key points about TRICARE and FMP at Bangkok Hospital Chiang Mai.
All right, John. Thank you. Roger that. So Bangkok Hospital Chiang Mai is one of very few hospitals that accepting TRICARE and FMP. And also, the wonderful thing about this hospital, there is no waiting. If you want to see a specialist, you want to see a doctor, you want to get something done, you can get that done immediately or on the spot with a little waiting maybe. So, and also we provide a full services. All the specialist availability here. You can have easy access to get to them. You can see them same day and get procedure done on the same day and get the results so you know what is going on with you. And finally, the quality of the care in Bangkok Hospital Chiang Mai is a very high standard, international standard. It had been certified by JCI 3 times already and going to be the fourth one during this month. So that speaks loudly of Bangkok Hospital Chiang Mai.
Absolutely. These are all such great examples of the value proposition of getting your health care in Asia and specifically at Bangkok Hospital Chiang Mai.
That's correct. Yep, one of the best.
So, again, thank you for being on the podcast. It was a pleasure to have you and to explain all this. And I look forward to maybe having another episode in the future.
All right. Thank you, John, for having me on your show. Appreciate that.
Thank you.
Thank you.
I'm your host, John Linebaugh, and I want to thank you for joining us today on the Health Me Asia podcast. Please hit like and subscribe and see the links in the description for contacts at Bangkok Hospital Chiang Mai.